Occupational English Test. Listening Test. This test has 3 parts. In each part you'll hear a number of different extracts. At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear.
Extract 1, questions 1 to 12. You hear a physiotherapist talking to a patient called Mrs. Rose. For questions 1 to 12, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good morning, Mrs. Rose. How are you doing today?
Good morning. Not too well, I'm afraid. I've been struggling with some persistent pain.
I'm sorry to hear that. Could you give me some more details about your pain and any other symptoms you've been experiencing?
Of course. For the past several months, I've been dealing with a lot of pain in my lower back. It's a constant, dull ache, and it becomes sharper if I sit for too long or try to lift heavy objects. It's really starting to affect my daily life.
That sounds quite challenging. Have you noticed any specific triggers that make the pain worse?
Yes, sitting for extended periods, especially at my desk for work, seems to be the main trigger. Also, any kind of heavy lifting or strenuous activity tends to aggravate the pain. Even simple household chores can sometimes set it off.
I understand. Have you had any previous injuries or conditions that might be related to this pain?
Yes, a few years ago, I had a minor back injury, but it wasn't very serious. This pain feels different, more persistent and harder to manage.
Okay. Have you tried any treatments or medications to help alleviate the pain?
I've been taking over-the-counter painkillers, but they don't seem to provide much relief. I've also tried using a heating pad, which helps temporarily, but the pain always comes back.
Right. Have you made any changes to your daily routine or activities to try to manage the pain?
Yes, of course. I've started doing some basic stretching exercises in the morning, and I try to take breaks and walk around a bit during work. However, it's hard to keep up with it consistently, especially when work gets busy.
Good. It's important to find a balance between activity and rest. Have you noticed any improvements with the stretching exercises?
A little, yes. The stretches do provide some relief, but it's not enough to make a significant difference.
Oh, I see. Let's do a physical examination to better understand the nature and severity of your pain. We'll then develop a personalized treatment plan tailored to your needs. Does that sound good to you?
Yes, that sounds good. I'm ready to get started.
Great. During the examination, I'll be assessing your range of motion, muscle strength, and any areas of tenderness. This will help us pinpoint the cause of your pain. Based on the findings, we might incorporate specific exercises, manual therapy, and other modalities into your treatment plan.
That sounds comprehensive. I appreciate the thorough approach.
We'll also discuss ergonomics and posture, especially concerning your work environment, to ensure that you're not inadvertently contributing to your pain. Making small adjustments to how you sit and move can have a big impact.
That makes sense. I've heard that poor posture can cause a lot of issues.
Exactly. Additionally, we'll work on strengthening your core muscles, which play a crucial role in supporting your lower back. This will help alleviate the pain and prevent future injuries.
I'm looking forward to learning more and finding some relief.
Together, we'll create a plan that fits your lifestyle and goals. It might take some time and dedication, but with consistency, you should start to notice improvements. Let's get started with the examination now.
Extract 2, questions 13 to 24. You hear a hospital dermatologist talking to a new patient called Mrs. Kelly. For questions 13 to 24, complete the notes with a word or short phrase that you hear. You now have 30 seconds to look at the notes.
Good afternoon, Mrs. Kelly. How can I help you today?
Good afternoon. I've been having some trouble with my skin recently, and it's been quite frustrating.
I'm sorry to hear that. Can you tell me more about the issues you've been experiencing?
Yes, over the past few months, I've been getting these itchy, red patches on my arms and legs. They come and go, but they're quite uncomfortable and sometimes they get worse.
I see. Have you noticed any specific triggers that might be causing these flare-ups?
Well, it's hard to say for sure, but I think they might be related to stress. My job has been quite demanding lately, and it seems like the symptoms get worse during particularly stressful times.
If you don't mind, may I ask, what do you do for a living?
Of course, I'm a software engineer. I spend long hours at the computer, which doesn't help with the stress.
Okay. Have you had any other symptoms or skin issues in the past?
I've had minor issues with dry skin before, but nothing as severe as this. Occasionally, I get small rashes, but they usually go away on their own.
Do you have any family members with any skin conditions or allergies?
Yes, my mother has eczema, and my younger brother has some allergies. I'm wondering if this could be hereditary.
It's possible. Family history can play a role in skin conditions. Have you tried any treatments or medications for your current symptoms?
Well, I've been using over-the-counter hydrocortisone cream, but it doesn't seem to provide much relief. I've also tried moisturizing regularly, which helps a bit, but the itching and redness keep coming back.
Have you made any changes to your diet or lifestyle that might be affecting your skin?
Not really. I've been trying to eat healthier and stay hydrated, but my routine hasn't changed much. I think the main issue is the stress from work.
Well, stress can definitely be a factor. Let's do a thorough examination to better understand your symptoms. We'll then develop a personalized treatment plan that addresses both your skin condition and the potential triggers. Does that sound good?
Yes, that sounds like a good plan. Thank you.
Great. During the examination, I'll be looking at the affected areas to determine the severity and characteristics of the rash. We might also consider some allergy testing to rule out any potential allergens.
That makes sense. I'm open to whatever tests or treatments you think are necessary.
We'll also discuss strategies for managing stress, as that seems to be a significant trigger for you. Incorporating stress-reducing activities into your routine could help improve your skin condition.
I'd appreciate that. I'm willing to try anything that might help.
Together, we'll create a comprehensive treatment plan that includes topical medications, lifestyle changes, and stress management techniques. With time and consistency, you should start to see improvements. Let's get started with the examination now.
That is the end of Part A. Now look at Part B. Part B. In this part of the test, you'll hear 6 different extracts. In each extract, you'll hear people talking in a different healthcare setting. For questions 25 to 30, choose the answer A, B, or C, which fits best according to what you hear. You'll have time to read each question before you listen. Complete your answers as you listen. Question 25. You hear a patient talking to a dental receptionist. Now read the question.
Hi, I need to schedule an urgent appointment, please.
Of course. Who is your regular dentist?
Dr. Shepard.
I see. Is it urgent due to pain?
Yes, it's the tooth Dr. Shepard filled for me last week.
I'm sorry, but Dr. Shepard is not available today. However, Dr. Bruce has an opening this afternoon.
That should be fine. But can Dr. Shepard see me tomorrow?
Yes, we can schedule you as the first appointment tomorrow morning. Will you be able to manage until then?
I'm avoiding chewing on that side, and the painkillers are helping. The pain started after eating something crunchy, so I'm worried I might have disturbed the filling. I'd prefer if Dr. Shepard could take a look.
Understood. We'll book you in for tomorrow morning at 9 a.m. with Dr. Shepard.
Question 26. You hear part of a presentation to nursing staff about patient belongings. Now read the question.
Now, you'll have received the guidelines regarding the management of patient belongings, and undoubtedly you have your own thoughts on its implications for your work. You're likely aware of the importance of ensuring patient belongings are well managed, as it contributes to both patient comfort and safety. This isn't in question, but naturally, the process must be handled efficiently. I've heard concerns about how busy everyone is, that you're already juggling numerous tasks without having to add the responsibility of managing patient belongings. Well, we've taken great care in planning measures to ensure that this process is as smooth and unobtrusive as possible. First and foremost, patients and their families will be provided with clear instructions on how to manage their belongings. This includes a list of do's and don'ts to outline expectations and responsibilities. For instance, we'll encourage them to label all personal items clearly and avoid bringing valuables or large amounts of cash.
Question 27. You hear a nurse talking to a patient who scalded her arm. Now read the question.
Hello again, Mrs. Grogan. Have the painkillers worked?
Hello, nurse. Yes, the pain is much less. My arm just feels sore.
The plan is to keep the scald dry and warm and let it heal. I've come to put a dressing on your arm.
I don't want anything that will stick.
The dressings we use don't stick anymore, they are made to be non-adherent.
I remember the pain while taking off the dressing years ago when dressings did stick.
The dressing only needs to be on for a few days and the scald will heal. It was a good thing that you knew the first aid for scalds. Cooling the skin down certainly stopped it getting any worse.
Question 28. You hear 2 physiotherapists discussing about a patient. Now read the question.
Hey, I wanted to discuss our plan for Mr. Jack, the patient who just had knee replacement surgery.
Absolutely. Given that he's in the immediate post-op phase, we'll start with some basic exercises to ensure joint mobility and prevent any complications.
Agreed. We should begin with ankle pumps and quadriceps sets. This will help improve blood circulation and activate the muscles around the knee.
Yes, and we should also focus on deep breathing exercises to prevent any pulmonary complications. As for the knee, gentle range of motion exercises will be crucial.
I think we should introduce heel slides and straight leg raises by day 2 or 3.
Actually, I beg to differ. I believe it's better to delay straight leg raises until Mr. Jack's knee is a bit more stable. I'm concerned that introducing them too soon could cause discomfort or strain.
Question 29. You hear a surgeon talking to students about risks in robotic surgery. Now read the question.
Good afternoon, everyone. Today, we're going to discuss the fascinating field of robotic surgery and the risks associated with it. As you know, robotic surgery is a significant advancement in the medical field, offering numerous benefits such as increased precision, smaller incisions, and faster recovery times for patients. However, like any medical procedure, it comes with its own set of risks. One of the primary risks in robotic surgery is the possibility of technical malfunctions. The surgical robot is a highly sophisticated piece of equipment, and while rare, failures can happen. These malfunctions could be due to software glitches, mechanical issues, or power failures. It's crucial for the surgical team to be well versed in handling such situations and have backup plans in place.
Question 30. You hear a surgeon talking to a patient who's just had a knee surgery. Now read the question.
How are you feeling, Mr. John?
Exhausted. But the painkillers must be working. I can't feel my knee, as you told.
You're bound to feel weary after an operation. It went well, though. We cleaned out loose cartilage from the joint. You can go home now.
Oh, thanks. I had an arthroscopy on the other knee several years ago, so I know what it's like. The idea that it gets done in less than a day is still pretty mind-boggling, though.
You'll need crutches for 2 weeks, but you should be walking okay within a month. Give it 4 months before you put any serious impact on it, though.
4 months. After my last op, I started running again within a month. Thinking about it though, I guess I paid for it. That knee had a lot of niggles for months afterwards.
If your body's hurting, it's telling you something.
That is the end of Part B. Now look at Part C. Part C. In this part of the test, you'll hear 2 different extracts. In each extract, you'll hear health professionals talking about aspects of their work. For questions 31 to 42, choose the answer A, B, or C, which fits best according to what you hear. Complete your answers as you listen. Now look at Extract 1. Questions 31 to 36. You hear an interview with Dr. Matiner about her work with patients who are learning to cope with SLE. You now have 90 seconds to read questions 31 to 36.
I'm joined today by Dr. Martina, who specializes in the treatment of autoimmune diseases. Dr. Martina, SLE, or systemic lupus erythematosus, is a particularly challenging condition. Can you tell us a bit about what it is? And how do patients usually react upon being diagnosed with SLE?
Of course. Systemic lupus erythematosus, commonly known as SLE or lupus, is a chronic autoimmune disease where the body's immune system mistakenly attacks its own tissues and organs. This can lead to inflammation and damage to various parts of the body, including the skin, joints, kidneys, heart, lungs, blood cells, and brain. The exact cause of SLE is not fully understood, but it is believed to result from a combination of genetic, environmental, and hormonal factors. Lupus is known for its unpredictable nature, with periods of illness called as flares alternating with periods of remission. When it comes to reactions to an SLE diagnosis, it can vary significantly among patients. Interestingly, some may feel a sense of relief, especially if they have been experiencing unexplained symptoms for a long time and now have an answer. Others may feel overwhelmed, anxious, or depressed due to the chronic nature of the disease and the uncertainty it brings. It's not uncommon for patients to experience a mix of emotions, including fear and frustration, as they come to terms with managing a lifelong condition. Emotional and psychological support, including counseling and support groups, can be crucial in helping patients cope with their diagnosis.
And what about the symptoms themselves? They can be quite varied, can't they?
Yes, SLE is often called the great imitator, because its symptoms can mimic those of many other diseases, making it challenging to diagnose. Common symptoms include extreme fatigue, joint pain and swelling, skin rashes, particularly the characteristic butterfly rash, across the cheeks and nose, photosensitivity, and fevers. Some patients may also experience hair loss, mouth ulcers, and Raynaud's phenomenon, where fingers and toes turn white or blue in response to cold or stress. In more severe cases, SLE can lead to complications such as kidney inflammation, lupus nephritis, neurological issues, seizures, cognitive dysfunction, and cardiovascular problems, pericarditis, myocarditis. The wide range of symptoms and their variability from patient to patient make individualized treatment plans essential.
Is there a standard treatment for SLE, or does it vary?
Treatment for SLE is highly individualized and depends on the severity of the disease and the specific organs affected. The primary goals of treatment are to control symptoms, prevent flares, and reduce organ damage. Common medications include nonsteroidal anti-inflammatory drugs, NSAIDs, for pain and inflammation, antimalarial drugs, such as hydroxychloroquine, to reduce disease activity, and corticosteroids to control severe inflammation. Immunosuppressive drugs like azathioprine, mycophenolate mofetil are often used to suppress the overactive immune response. Recently, biologic agents such as belimumab have been introduced to target specific pathways in the immune system. Patients with severe organ involvement may require more aggressive treatments, including high-dose corticosteroids and immunosuppressants. Regular monitoring and follow-up are crucial to adjust the treatment plan as needed and to manage any side effects.
I've heard that lifestyle changes can also play a role in managing SLE. Could you elaborate on that?
Absolutely. Lifestyle modifications can significantly impact the management of SLE. Patients are encouraged to adopt a healthy diet rich in fruits, vegetables, whole grains, and lean proteins, while avoiding excessive salt and processed foods. Regular physical activity, tailored to the patient's abilities, can help reduce fatigue, improve joint function, and enhance overall well-being. Stress management techniques, such as yoga, meditation, and mindfulness, can also be beneficial, as stress is known to trigger flare-ups. It's important for patients to avoid smoking, as it can worsen symptoms and increase the risk of cardiovascular complications. Sun protection is critical, as UV exposure can trigger skin rashes and flares. Patients should use broad-spectrum sunscreen, wear protective clothing, and avoid peak sunlight hours. Additionally, staying up to date with vaccinations, managing comorbid conditions, and maintaining regular medical checkups are essential components of comprehensive SLE management.
Are there any new treatments or research developments that you're particularly excited about?
Yes, the field of lupus research is evolving rapidly, and there are several promising developments. Researchers are exploring targeted therapies that can more precisely modulate the immune system without the broad suppression seen with traditional treatments. For example, new biologics and small molecule drugs are being studied to target specific pathways involved in the disease process. Advances in understanding the genetic and environmental factors contributing to SLE are also paving the way for personalized medicine approaches, where treatments can be tailored to an individual's unique genetic makeup and disease characteristics. Additionally, there's ongoing research into biomarkers that can help predict disease flares and response to treatment, potentially leading to more proactive and effective management strategies. Clinical trials are continually testing new therapies, and patients with SLE are encouraged to discuss potential participation with their healthcare providers.
That's encouraging. Is there anything else you'd like to add about living with SLE?
Living with SLE requires a comprehensive and proactive approach. Patients should work closely with their healthcare team to develop and adhere to a personalized treatment plan. Education about the disease and its management is crucial, empowering patients to recognize early signs of flares and seek timely medical attention. Emotional and psychological support, including counseling and support groups, can help patients cope with the challenges of living with a chronic illness. Building a strong support network of family, friends, and healthcare providers is essential. While managing SLE can be demanding, many patients lead fulfilling lives by staying informed, engaged in their care, and adopting healthy lifestyle habits. Advances in research and treatment continue to offer hope for better outcomes and improved quality of life for individuals with SLE.
Now look at Extract 2. Extract 2. Questions 37 to 42. You hear a dermatologist called Dr. Robert Maxwell talking about a skin condition called harlequin ichthyosis. You now have 90 seconds to read questions 37 to 42.
Hi, my name is Robert Maxwell. I'm a dermatologist working here in the hospital. I'm going to talk about a rare skin condition called harlequin ichthyosis. I'm going to present a case study or two to show you clinical significance of the condition. Alright, first of all, harlequin ichthyosis is a rare genetic skin disorder that affects newborns. It is characterized by the formation of thick, hard plates of skin that crack and split apart. These diamond-shaped plates can distort facial features, such as the ears, eyelids, nose, and mouth, and limit the movement of arms and legs. The condition can also cause breathing and feeding difficulties. It is caused by mutations in the ABCA12 gene, which is responsible for transporting lipids out of cells in the outermost layer of the skin. The disorder is inherited in an autosomal recessive manner, meaning both parents must carry a copy of the mutated gene for their child to be affected. Now, when it comes to clinical presentation, the condition can present among newborns differently at varying times. However, typically one can observe thick, plate-like scales of skin covering the body, distorted facial features, for instance, turned-in eyelids and lips, and also restricted chest movement, leading to breathing difficulties. The risk of infections and dehydration is high because of disrupted skin barrier. It is important for frontline caregivers to be aware of the clinical features of harlequin ichthyosis to facilitate early diagnosis and prompt management, preventing complications. It is important to talk about diagnosis and treatment of the condition. The diagnosis of harlequin-type ichthyosis relies on both physical examination and laboratory tests. Physical assessment at birth is vital for the initial diagnosis of harlequin ichthyosis. Genetic testing is the most specific diagnostic test for harlequin ichthyosis. This test reveals a loss-of-function mutation on the ABCA12 gene. A skin biopsy may be done to assess the histologic characteristics of the cells. Histological findings usually reveal hyperkeratotic skin cells, which leads to a thick, white, and hard skin layer. Constant care is required to moisturize and protect the skin. Management includes supportive care and treatment of hyperkeratosis and skin barrier dysfunction. A humidified incubator is generally used. When it comes to prognosis, in the past, the disorder was nearly always fatal, whether due to dehydration, infection or sepsis, restricted breathing due to the plating, or other related causes. The most common cause of death was systemic infection, and sufferers rarely survived for more than a few days. Improved neonatal intensive care and early treatment with oral retinoids, such as the drug isotretinoin, may improve survival. Children who survive the neonatal period usually develop a less severe phenotype, resembling a severe congenital ichthyosiform erythroderma. People continue to suffer from temperature dysregulation and may have heat and cold intolerance. Patients can have generalized poor hair growth, scarring alopecia, contractures of digits, arthralgias, failure to thrive, hypothyroidism, and short stature. Most infants do not live past a week. Those who survive can live from around 10 months to 25 years thanks to advanced medicine. Now I would like to mention about few cases I came across. First case involved a 33-week-old female baby born via emergency cesarean section. The baby presented with thick keratotic plaques, eclabion, ectropion, and microcephaly. The team tried everything they could do, however, she succumbed to sepsis after a few days of fight. A second case involved a newborn boy with no family history of the condition. The baby was born prematurely and exhibited severe skin abnormalities. Unfortunately, the baby passed away on the 4th day. In both cases, the primary care team was surprised as it was their first case of this condition, and they collaborated with specialists at various centers to coordinate care. However, it was of no avail. Lastly, it is apparent that parents of newborn born with this condition will endure psychological consequences like stress, depression. It is paramount that provisions are made for addressing these issues. Measures should be in place to ensure availability of trained mental health professionals and counseling for needy family members. I hope this presentation will shed light on relatively rare conditions seen among newborns and will help concerned team members to recognize and take relevant measures to manage.
That is the end of Part C. You now have 2 minutes to check your answers. That is the end of the listening test.